As we approach the third year of the pandemic, people with disabilities and advocates say healthcare systems and the government still have not been able to provide adequate COVID care. While people with disabilities are at higher risk, a report from the National Council on Disabilities finds they haven't been prioritized for vaccines in some states. In addition, advocates say the stress from COVID has exacerbated issues in healthcare that existed before the pandemic, like a shortage of direct care workers. Joining us now with more are Kristen Berg, an associate professor in the Department of Disability and Human Development at the University of Illinois, Chicago, and Andres Gallegos, chairman of the National Council on Disability and a board member of Access Living. Thanks to you both for joining us. Kristen Berg, let's start with you, please. How have you seen the pandemic affect young people with disabilities?
Well, it's been a crisis. There's no doubt about it. I can't tell you how many parents I've heard from and young people who are experiencing just epidemic rates of depression, anxiety. I'm also hearing from parents about behavioral challenges their children are experiencing, isolation, loneliness. So it runs the gamut, whether I hear about lack of access to necessary services because of the school shutdown, or whether I'm just hearing about a kid who's not getting out of bed or a kid who is banging their head. Because in many ways, they've been isolated, alone, and without the necessary services they need.
Andres Gallegos, what challenges do people with disabilities have when they are accessing testing specifically?
Well, testing is the ability to get to testing sites. In many instances, people with disabilities don't have access to transportation or readily available transportation. Here in Chicago, the personal ride-sharing services like Uber and Lyft are not accessible for people with disabilities, and therefore they have to rely either on mass transportation, which puts them at greater risk being around individuals who they don't know are vaccinated or not vaccinated, and just getting to the site itself.
Kristen, how has the shortage in healthcare access affected people, mentally and physically?
Well, the long waits have been just awful. I have a student, for example. She's one of the brightest students I've ever worked with. I worked with her in South Dakota. Now she's in Illinois. And every day she's wondering if she's going to end up back in a nursing home because she relies on direct care workers to participate in school and live independently. And that has definitely taken a toll on her mental health. She's also gotten behind in her classes and had to get various extensions. It's been incredibly stressful. I know lots of kids who are also on extensive wait lists to access needed mental health care, behavioral health care, and with no end in sight. And you know what? They're ending up in the emergency room. So that's a real problem. That tells you our system is failing our kids with disabilities if they're ending up in the emergency room when we know many of these issues could have been prevented with early screening and care, but it's just not available.
Andres, the National Council on Disability found that the state rollout of vaccines did not always prioritize people with disabilities, people who are chronically ill. Tell us a little bit more about that, please.
Look, I mean, what we found was a significant amount of indifference or ignorance in light of the fact that people with disabilities were at a higher propensity to contract the disease and had a greater propensity for poorer outcomes once contracted. Many states still deprioritized people with disabilities for the vaccination. And as a result, some of those decisions had deadly consequences as well. So it's what we've seen is not unlike what we've seen prior to the pandemic, where people with disabilities are discriminated against in the healthcare system, a healthcare system that has not addressed the needs and has not been welcoming for people with disabilities in this country.
And Kristen, that leads to, this notion of just living with COVID. We'll all be living with it for some time, and that people should just accept that this is the new reality, except, that is troubling for people who have disabilities.
Absolutely. And I think there was a quote earlier from the CDC this week saying that, oh, this is fantastic. Now, the only people who are dying, 75% of those dying are those with multiple comorbidities. Well, those are people with disabilities. Those are people like me. Those are my friends. Those are some of my relatives, right? Those are my colleagues. They're the ones dying, and it doesn't feel like a victory yet. We're the ones, we can't go places. We have to continuously navigate these fears, challenges, and make decisions about our personal safety at this point. We can't go back to normal yet.
And I hear you referring there to the statement from Rochelle Walensky, the CDC head, and something that it's been a very controversial statement this week where she was referring to a small subset of people in a test group based on a study. But I want to ask both of you, and Andres, I'll start with you first. What action would you like to see from the government or at the local or federal level to provide better COVID care for people with disabilities?
Well, there's a number of things, right? And that is to look at us not as a condition or a disease, but as a patient population. We suffer from the fact that despite that we're over 64 million people in this country, we're not viewed as a minority group. We're not viewed as any cohesive group for purposes of any public health surveillance programs or any interventions. But what we really want to see is health equity for people with disabilities. The National Council on Disability is putting the final touches on a health equity framework for people with disabilities. And the issues that we see during the pandemic, we've seen, as I mentioned before, prior to the pandemic as well. And so we have to address the failings and the shortcomings of the healthcare system when it comes to people with disabilities.
And that's actually where we'll have to leave it. We're out of time. But my thanks to Andres Gallegos and Kristen Berg for joining us.
Thank you so much.
Thank you.